Hi, my name's Kaylin Abe, and for my extra credit assignment, I'm going to be talking about atoms, ions, and isotopes in medicine, and how isotopes are used in imaging and treatment. So, I wanted to go over a review of atomic structure and isotopes. So, just as review, protons are positively charged particles that have a mass of 1 atomic unit and are located in the nucleus. Electrons are negatively charged particles that orbit the nucleus and have a mass of 0 atomic units. And neutrons are particles with 0 charge that have a mass of 1 atomic unit and are located in the nucleus. Isotopes are atoms with the same number of protons but different numbers of neutrons, and that's going to kind of be the focus of this presentation. So, going into radioactivity, this wasn't something that was discussed in this class specifically as much, but it is in the textbook towards the end. I found most of this information in chapter 17. So, to define radioactivity, radioactivity is the emission of tiny subatomic particles by the nuclei of certain atoms, and these particles can pass through solid matter. The atoms that emit these particles are said to be radioactive. When the nuclei are emitting these particles, they're trying to reach a stable state. And radioactivity is used in medical imaging and to treat diseases such as cancer. So, types of radioactivity, there are alpha particles, which are large and easy to block, even with something as thin as a sheet of paper. They can't get through our outer layer of dead skin cells, so they aren't a danger externally, but they can be very damaging to cells if we breathe them in, ingest them, or they enter through an open wound. Beta particles are smaller than alpha particles, and they can travel several feet, and they can present an internal hazard if we breathe them in, ingest them, or if they enter through an open wound, similar to alpha particles. These can cause burns on exposed skin, but they could be blocked by clothing. Now, gamma rays are mostly an external hazard because of their ability to go through material, and it takes a few inches of lead to block gamma rays, like when you go to the dentist. Gamma rays can be an internal hazard if we breathe them in, ingest them, or they enter through an open wound, but the internal damage isn't as severe as that done by alpha and beta particles. And positrons have a mass of an electron, but they carry a positive 1 charge. And in some unstable nuclei, a proton changes into a neutron and emits a positron. So, going into half-life is the time it takes for half of the radioactive ions of a specific radioactive substance to decay. And some have a very long half-life, such as uranium, which has a half-life of almost 4.5 billion years, and some have shorter or extremely short half-lives. Most of the materials used in medicine have short half-lives, and after 7 half-lives, you'll have less than 1% of the original amount of radiation. So, some other common uses for radiation before we turn towards medicine are materials containing biomatter can be dated based on the amount of non-decayed carbon-14 in them through radiocarbon dating. The atomic bomb involves nuclear fission or the splitting of the atom, and related to fission, nuclear power requires nuclear reactors to help generate power. So, some common isotopes used in medicine are technetium-99, which is used as a tracer in nuclear medicine and medical imaging in general, phosphorus-32, which is given to cancer patients because it's taken up by cancerous tissues so that physicians can locate and identify cancerous tumors, and iodine-131, which is used to diagnose thyroid disorders. So, some isotopes in CT and PET scans. Both CT and PET scans involve radioactive tracers, which emit gamma rays from within the body. CT uses single photons detected by a gamma camera, which can view organs from many different angles. PET scans use positron emitting radionuclides, which are detected by a PET camera and give very precise locations. And PET is more sophisticated and precise, and new procedures combine them together for greater accuracy. So, some isotopes in cancer treatments. One type of radiation therapy is called teletherapy. It focuses gamma radiation onto a precise area of the brain with a cancerous tumor. Brachytherapy involves injecting a small radiation source, usually a gamma or beta emitter, into the target area. And other uses include bone marrow transplants and palliative pain treatment. So, as we know, there are some negative effects of radiation. Radiation can cause acute radiation damage, which results from exposure to large amounts of radiation in a short period of time, such as a nuclear bomb or exposed nuclear reactor cores. When this happens, large numbers of cells are killed, and dividing cells, such as those in the immune system and the intestinal lining, are the most susceptible. There could be an increased cancer risk, so lower doses of radiation over extended periods of time can damage DNA and cause cells to grow abnormally and become cancerous. These cells can become tumors that can spread and cause death, and it could also lead to genetic effects, where if radiation damages the DNA of reproductive cells, such as eggs or sperm, the offspring that develop from those cells may have genetic abnormalities. This is mostly observed in lab animals and hasn't been seen in humans yet, even in studies of people who survived the Hiroshima atomic bomb. So, the use of radiation in medicine is kind of a balancing act. As a cancer patient's radioactive medicine dose does increase the cancer risk by about 1%, but if the patient has a 100% chance of dying from the cancer that they already have, then the risk is usually worth it. So, in sum, radioactivity is when unstable atomic nuclei emit subatomic particles, alpha, beta, gamma, or positrons, in an attempt to reach a stable state. Radioactivity is widely used in medicine for imaging, such as CT and PET scans, diagnosis, and cancer treatment through targeted radiation therapies. And radiation exposure can cause acute cell damage, increased cancer risk, and potential genetic defects. But in a medical context, the benefits often outweigh the risk. So, thank you for watching my presentation and the solid class.